Hello friends, today's topic is osteoarthritis. It is the most common and important and relevant topic. Osteoarthritis is the most common form of arthritis and major causes of pain and disability of the older people. And osteoarthritis is basically the destruction of the joint structure and destruction of the cartilage around the joint. It is most commonly affect the knee joint, and 45% affected the knee joint, and after that the 25% affect the hip joint, and women are mostly affected. 11% affected according to data. Women are mostly affected of osteoarthritis, and men are less commonly affected, 8%. What are the pathophysiology of osteoarthritis? Between two bones reduce the gap. I want to show you a picture and plain X-ray of the knee joint, and this one, a normal picture, a picture of this is a plain. This is a X-ray of the plain X-ray of the knee joint, and between two bones a gap, there is a gap, but in case of osteoarthritis it reduce the gap and there is a bony formation. There is a new bony growth formation that is called the osteophyte. This is a peculiar case or peculiar X-ray of peculiar picture of osteoarthritis in X-ray, and there are also a proliferation formation, and there is a abnormal nest or proliferation formation. There is a pathophysiology of osteoarthritis. After that, and what are the risk factor of osteoarthritis? Within the risk factor, there are some genetic causes like the skeletal dysplasia and polygenic inheritance, and number 2, the developmental abnormality, like as there are some developmental abnormality, and there is after that the occupational loading, occupational factor, like as the farmer, the miner, and some athletes, they most commonly occur the osteoarthritis. And other that, there are some medicational causes, and the obesity, trauma, and the hormonal like as the estrogen deficiency, especially in women, and the aromatase inhibitor like users. And after that, what are the clinical sign and symptom of osteoarthritis? What are the clinical sign, symptom and sign of the osteoarthritis? Most common and important symptom is pain. It is a insidious or gradual type of pain, insidious onset over months or years, and intermittent in character. The intermittent in character, the nature like as the good day or bad day. Patient says the day is very good, but after that tomorrow is very good, and today is very bad. That type of intermittent nature, but intermittent type of pain, mainly related to the movement, and it is basically the weight bearing pain in the weight bearing joint. They aggravate the movement, and it stay 15 minutes, and morning stiffness occur. Usually only one or few joints are painful, and it is the symptom. And clinical sign is restricted movement, and sometimes the palpitation around the joint, and a crackling sound occur, and a audible sensation can be, and chorus crepitation may be seen. and bony swelling and deformity may be seen, and muscle weakness and stiffness may be seen. These are the clinical sign, and after that we shall go for investigation. What is the investigation? And most common and important and best investigation is plain X-ray of this joint, basically knee joint or hip joint, plain X-ray, AP and lateral view. After that, hematology and autoantibody tests are usually normal, and the synovial fluid of this joint, of this particular joint, aspiration should be done, and there must be shown the low cell count. After that, the management of the osteoarthritis. Management basically the lifestyle advice or lifestyle modification, like as the regular exercise and the weight reduction, and after that a dietary factor is the most important. Dietary management, food habit is very important to reduce the red meat intake. Mutton, beef, pork should be avoided, large fish should be avoided, and should take green vegetables and plenty of fluid, water at least 4 to 5 liters per day, and regular exercise, and control the weight, and weight reduction is the most important management of osteoarthritis. And after the medication, in allopathic medicine there are stage specific medicine should be there, and in final stage the knee replacement occur. But homeopathic constitutional treatment is a very marvelous result will become. There are few cases I have shown to you in my YouTube channel Dr. S. Mandal Official and Facebook also. The patient improves a lot by the constitutional treatment. Thank you.